get started here. We're going to be talking today, of course, about natural cancer prevention, and specifically, we want to give you guys some insight to adjunct therapies that can be very helpful for people who are dealing with a diagnosis of cancer. I'm Dr. Molly Force. I'm the clinical director here at Prosper Natural Health, and I'm joined today by Dr. Rosalie and Dr. Mary. And this care team, I feel like, is a really unique one because we have this broad perspective from the natural medicine world, being naturopaths. And then we also have additional resources that we can call on within our practice, with Dr. Rosalie having a background in Ayurvedic medicine and Dr. Mary having a background in Chinese medicine and acupuncture. So as we go through today, we're going to be talking about a lot of different options for people. But before we get into that, we wanted to make sure everyone was kind of on the same page about what happens in the initiation of the cancer process, and specifically this role in cellular damage. So initially what happens is there's some kind of trigger that causes cellular damage. And as that damage occurs, there's a protein misfolding. And that protein misfolding leads to this inflammatory response within the body. And often we see that go hand in hand with an oxidative stress that's happening for those cells. And in response, we can get a cascade of inflammatory messengers, these chemical signals. And what happens at that point is we can also lose, as part of our cellular reproduction and splitting, we can lose that differentiation for those cells of the ability to see a programmed cell death sequence that's supposed to be happening, and that's known as apoptosis. So whenever we have the loss of that, we can have this proliferation or reproduction of these cells, these dividing of these cells in a way that's no longer controlled by the body, and we have this lack of this protective cellular mechanism to tell these cells to stop proliferating and stop growing. So there are so many different triggers that can initiate this cellular damage. And we're going to go over several of these today, but this is really important to think about in regards to not just the prevention piece, which is really core for any kind of oncology discussion, but also for the prevention of reoccurrence piece. So we know that there can be some genetic predispositions for people that lead them to a cancer diagnosis. We also know there's significant evidence in the literature, in the medical literature, that there can be environmental toxicants that can damage our cells, and that can lead to the cancer process. We know that aging is a factor. We know that lifestyle can play a big role here. And we know that hormones can affect certain cell lines and certain cancers as well. And then we also know that there are certain pathogens. So this can be bacteria or viruses. And specifically, we know that like Epstein-Barr virus, HPV, those two viruses in particular, and H. pylori, which is bacteria, have significant research about them being involved with certain types of cellular damage and certain cancer as a result. So our approach as naturopathic physicians, of course, starts with prevention. So we want to be thinking about things that are going to really trigger damage to the cells and ways that we can reduce that damage and the output of those cells after they get exposed to that damage. We also, of course, want to be thinking about the root cause of the cancer process. And sometimes that's clear. Sometimes, like, for example, with those pathogens, there can be a direct relationship. And then other times our patients are never truly able to understand what exactly was the root factor or the multiple factors that caused that cancer process to begin. If we can identify it, though, it can be very helpful for us for helping reduce that prevention of reoccurrence and to make sure that that cellular damage isn't continuing to happen. Of course, we want to reduce any of these contributors to that cellular damage or the cancer process that we know of. So we want to reduce these cofactors that are involved. So we're always talking about that with patients. And then we also want to make sure that if we are having our patients are undergoing cancer therapies, that we can help them throughout that process, really mitigating some of the side effects and really helping them with some of the long-term secondary side effects from those chemotherapy agents in particular, or radiation therapy, or whatever that cancer treatment strategy is. So we want to be supportive at the same time that we are helping people get through that process. And then we also want to be thinking what we can do long term for that prevention of the reoccurrence, of course. So this is a nice little graphic that shows the different triggers for the different types of cancer. Because remember, these abnormal cellular behaviors are often happening initially in just one type of cell line for most cancers. And so, for example, we know with lung cancer, we know that tobacco is a huge risk, but we also see some occupational hazards. So depending on what people are exposed to in the workplace, that can also increase their risk. We know that low fruit and veggie diet can increase their risk, and exposure to radiation can increase their risk. So this is just a great little graphic for you to refer to if you're wondering about the specific types of cancers and some of the major risk categories. And it's always good to kind of go through these and make sure that we're really doing everything we can to reduce our risk of this kind of cellular damage. One of the biggest pieces for us is finding balance. In the naturopathic world, we're always trying to have a proper balance in our treatment strategies and our lifestyles for our clients, for our patients. So today, I know a lot of you are here to understand more about things that you can do in a prevention realm, and then things that you can do in the approaches to alternative care realm. So we want to make sure that as we're giving these pieces of advice, that we're looking at a balanced system. We, at no point want to give too much of, a certain type of supplement or something like that, which could cause more side effects or something like that. So we're thinking about balance, we're thinking about stress reduction within that balance, and we're going to talk about some of those key strategies today. We also just wanted to say that here at Prosper, we have this awesome apothecary that's a physician grade apothecary, and we really curated these products specifically. But when we're working with our oncology patients and when we're, supporting them in their care, we always want to make sure that the rest of the care team is really looped in about what we're doing, that we're really thinking about it together so that we're not interfering with other care processes that might be happening, and that everybody's on board for the strategy, so nobody is interfering with the care plan. So it's always important to loop in all of your providers whenever we're starting something new. And we just wanted to say that even though these are awesome products, they may not be right during certain periods of your treatment. So it's very important to check in with your whole care team. When we're thinking about this integrative and alternative approach, one of the biggest pieces for us is really careful coordination with the oncology team. So we're working with certified oncologists to help our patient formulate a plan. And sometimes that means us calling and having conversations with the conventional docs about the plan. And other times it's sending notes. But we want to make sure that everybody on the care team is comfortable with what's going on and that the strategies make sense to them. And so that's a really important part for our strategy for us as clinicians at Prosper, especially. We really like to have everybody on board. We also really want to make sure, obviously, that we have a very clear identification of what our goals are for treatment. Cancer in general is such a broad topic, and there are so many different prognoses and outcomes for different patients that can happen. We want to be really clear in our expectations with patients and what their expectations are as well. You know, we really want to make sure that they're comfortable with their end care goals. As far as prevention, it's one of the areas that this type of medicine really shines. Of course, we need to be thinking about these foundational treatments. And when we think about foundational treatments, I think about it like a tree, which is why we have this tree imagery here of the roots that you're laying down are going to impact the overall structure and how strong that trunk system is, if you will. So we're thinking about what's coming in as far as foods, what's coming in regards to antioxidants, because we've already talked about cell damage, and we know that one of our most important ways to block that cellular damage is with adequate antioxidants. We want to be thinking about what's going on with sleep, because sleep in itself has an antioxidant activity. We want to be thinking about what's going on with movement, and we're going to talk about why that's so very critical. And then we want to be thinking about what's going on with the elimination of those toxins that your body may be exposed to. Of course, when we're thinking about the adjunctive care during active conventional treatment, so we're talking about chemo, radiation, and biologics, these pharmaceuticals that are given during cancer care. There's so much that can be done from the naturopathic and alternative Ayurvedic and the traditional Chinese medicine and acupuncture realm. We can be a very helpful adjunctive care provider to help really reduce some of the harmful side effects of these conventional treatments that we acknowledge need to be happening for our patients' best interest. So that's another area that we really love. It's very satisfying to be able to help people who are going through some of these more challenging treatments and to help them reduce the intensity or the discomfort during those treatments. And also, sometimes our goal is just simply allowing them to be on those treatments for longer periods of time. Sometimes it's a known piece of those treatments that there's a limited period that the person is going to be able to tolerate it. So if we can help them tolerate those treatments for longer, that's beneficial for the patient as well. So sometimes that's part of our care goal. As far as prevention of reoccurrence, this is speaking to once we have a clean diagnosis of that cancer having been resolved. Of course, we want to be really doing everything we can to prevent that reoccurrence and supporting our patients in the screening for that potential reoccurrence and doing everything we can to keep them as strong as possible and balanced as possible so we're not dealing with a reoccurrence.
Okay. So next we're gonna get into some of the specifics about our approaches. But first, I'm just going to explain the very sort of diverse strategies that we can take in preventing cancer initially and then preventing recurrence. So as you can imagine, this is a holistic process and it's a lifelong process. So we're going to look at a number of different factors, and it's rare that there's going to be any one, silver bullet that is the key. It'll often involve lifestyle and food and supplements, herbs, sometimes essential oils, and really focusing on gut health. And as we go through this lecture, we'll really get into the nitty-gritty of each of these. So here we have this concept of the multiple methods of detoxification. So this is really important for cancer prevention. As Dr. Molly mentioned in one of the initial slides, there are many things that can contribute to oxidative damage, to inflammation, and to endocrine disruption, and that's hormone disruption, that can predispose us to different kinds of cancers. So from a naturopathic medicine perspective, we really want to be thinking about how are we eliminating those toxins that we will inevitably be exposed to throughout our life. So that can be through the lymphatic system. So that's kind of like our blood vessel system, but it goes kind of parallel to that. And it runs all throughout our body. And it is a way of carrying fluids and toxins back to our heart so that we can then excrete it in our digestive system and through our kidneys. So in order to promote our lymphatic system, we really want to get movement. We really want to think about using hydrotherapy and contrast hydrotherapy that we'll discuss a bit later. And we'll often recommend dry skin brushing. So that's going to be lightly brushing your skin, always starting from your extremities and moving towards your heart to enable that lymphatic flow. We also think about the lungs. So every time we breathe out, we're eliminating through our lungs. We want to think about the liver. So the liver is a really important organ that is essentially packaging all of our toxins for excretion. It's like a factory that processes and packages them. And when we overtax the liver and don't give it enough chance to keep up with all of the packaging, we are not eliminating properly. So liver support's really important. Our kidneys are another really important organ of elimination through our urinary system. So that is, we will often, make sure that we are looking at kidney health, making sure that we're monitoring that over time to see if that's functioning properly. And then we have our colon. So this is the way we excrete a lot of our hormones and many other toxins. And so long-term chronic constipation is something we're always addressing if it's on board. That means you're not having that elimination through your colon as optimally as we would want. And then lastly, we'll think about skin detox through the skin. So that's usually through sweating. And we'll get more into that when we talk about movement and therapeutic sweating a bit later on. So there are a number of ways to support our liver health. So this is to ensure that we are properly packaging all of those toxins to get rid of them. So we will want to think about exercise and maintaining a healthy weight. That will ensure that we're able to process things through our liver without kind of having added toxins stored in our fat cells. We want to make sure that we're eliminating or avoiding alcohol and certainly eliminating cigarettes. That is a huge thing when it comes to cancer prevention, particularly lung cancer, but really all kinds of cancer prevention, because cigarettes can really impact our vascular system. And then specifically with the alcohol and nicotine, those are toxins that are going to further burden our liver and prevent it from detoxing all of the other chemicals that we're exposed to on a daily basis. Next, we'll want to focus on a whole foods diet. So this is going to allow us to get our proper nutrients to that all act as cofactors in the liver to make sure that we can package things properly, and also gives us enough fiber so that we can, when the liver sends all of these packages to the digestive system, we can be sure to excrete it. We also want to stay hydrated, getting half of your body weight in ounces of water per day. And then we want to supplement wisely. So one of the things that is a big red flag is if you have 2 full pages of supplements that you're taking on a daily basis. Supplements are great. We love to use them, but they also can tax your liver. So we want to make sure that you're not on too many and that you're on the ones that you really need and getting rid of the ones that you don't. All right. So the next piece is going to be avoiding any exposure to any unnecessary exposure to chemicals and pharmaceuticals that can impact our methods of detoxification that can be pro-inflammatory and promote oxidative stress. So first, we really want to eat organic. There are a number of different antibiotic residues that can present in dairy and meat and eggs. They tend to concentrate in animal products because they're consuming so many of the produce that has a lot of so antibiotics are used in meat production, and then also there will be a concentration of pesticides in dairy, meat, and eggs from the animals consuming a lot of vegetables that have the pesticides on them. And we know that, for instance, glyphosate is associated with kidney malignancy. So another thing to pay attention to. Dr. Rosalie will talk about the dirty dozen and specific ones to avoid or focus on avoiding. We also want to avoid preservatives whenever we can. These can significantly impact our gut microbiome and can have undesired reactions in our large intestine. And so we want to look out for things like sorbic acid, benzoic acid, and propionic acid on labels. And then lastly, we want to avoid phthalates. These are some of our major endocrine disruptors, and they can be found in plastics, cosmetics, and synthetic fragrances. And we'll discuss more on endocrine disruptors and what they are in a bit. All right, so how much water are you drinking a day? This is a really important question, and in order to answer this, it can be really helpful to have a water bottle with a known amount in it. So say a 32-ounce water bottle, and that allows you to calculate how much you're drinking. And it's a good idea to aim for half of your body weight in ounces per day, and then more if you drink strong coffee and if you're having a lot of sugar, because those can be dehydrating. We also want to pay attention to drinking clean, filtered water, having a good water filter on board to, again, avoid unnecessary chemical exposures. And then another thing related to water, but slightly different, is hydrotherapy. So we want to think about bringing contrast hydrotherapy into our life. This is going to be a really great way to cause vasodilation and then contraction. So that's our blood vessels expanding and contracting when we are exposed to hot water and then cold water. And this can really help with our circulation and lymphatic flow and help kind of flush toxins out of our cells, and also help with recycling old cellular debris that we want to get rid of. So an easy way to do this is take a hot shower and then end in a cold spray for 15 to 30 seconds.
Thanks, Dr. Mary. So the next slide here is all about nutrition because, as naturopathic physicians, we always talk about diet as part of a treatment plan. But nutrition is especially important for cancer prevention. And like Dr. Mary was mentioning, especially this concept of the dirty dozen. And if you do a quick Google search, if you're unfamiliar with this concept, do a quick Google search and it comes up with 12 types of foods that are conventionally produced and will sort of have an aggregate of pesticides on them. And so part of those foods are, some of those foods are strawberries and spinach and peaches, which is why it's important to get those specifically organic. Speaking of all of those delicious foods, the fruits and veggies have a lot of antioxidants in them, which is a big tactic when it comes to cancer prevention, to reduce that oxidative damage, which would otherwise contribute to DNA mutations, et cetera, in the cancer process. Mushrooms are superfoods when it comes to cancer prevention because they are immune modulating. As we know, cancer is an issue ultimately with the immune system no longer seeing that there's a problem, right? And so mushrooms help sort of upregulate and both downregulate when there's a cancer process going on. Specifically, turkey tail has been studied in this regard. And they stimulate anti-tumor activity through various methods. Anti-inflammatory diet is also a big one here. You'll hear us harp on that over and over again. Pre and probiotics are a last piece of importance here because you want a healthy microflora in your digestive system to absorb your food well and to prevent having some GI inflammation that would otherwise cause systemic inflammation. Some foods to include in your diet are a lot of anti-inflammatory whole foods, things like bone broth or seaweed, whole fruits, instead of ones that have been processed, etc. Healthy fats, we'll talk about omega-3s in a little bit, but ultimately you can read through this list and make sure you're choosing organic and non-farmed options. Foods to exclude include our inflammatory foods, the ones that, if you remember the infographic in the beginning, some of those foods show up in that infographic as potentially causing or contributing to several types of cancer, alcohol being a huge one. Again, everything in moderation, right? You know, here and there, so it goes. Same with processed and packaged foods, but it's something that we want to make sure if we are trying to prevent cancer or are undergoing a treatment, all of these inflammatory foods are going to, maybe not necessarily worsen the prognosis, but make it a little bit more difficult. Omega-3s are, very helpful for the brain, the body, and in general diminish inflammation in the inflammatory pathways. And they come from not just seafood, but also other types of foods, from flax oil to raw nuts and seeds and avocado oil. So it's worth thinking about how much of these omega-3s you're getting through the diet, not just in terms of a supplement, as compared to the other vegetable oils, which are full of omega-6s that would otherwise be more pro-inflammatory. It's all about the balance between these types of fats. So intermittent fasting is a topic that is also very relevant here, in that it's helpful both in prevention of cancers, but also there are studies on it being helpful while someone is undergoing a cancer treatment to help with the prognosis. And so intermittent fasting has to do with how many hours per the 24-hour day can you avoid calories, right? And maybe you can go a full 12 hours, right? And usually you fast overnight. Maybe you can only do 8. Who knows? Everyone starts at a different place, but this trying to extend that fasting period allows the GI tract to sort of heal and diminish inflammation throughout the whole body.
We wanted to make sure to talk specifically about antioxidants today because they're such a critical piece for you all to really understand about ways to protect your cells from further damage. And we also know that these antioxidants, what they're doing is they're quelling free radicals. So I often liken free radicals to my 4-year-old son who just goes around and just kind of tears rooms apart, just toys are flying everywhere. So it's kind of like that on the cellular stage. These free radicals go in and they cause this damage within the cells. And if antioxidants are available, they can calm down those free radicals and reduce the cellular damage that's happening. And they do this typically through a donation of either a hydrogen or another portion of a chemical that calms, that will basically quell that free radical and calm it down. So we want these antioxidants to be part of our lives, that we want them in our diet, and we may even want to be thinking about taking them in a supplementary form. Now, a really important piece here to understand is if you're currently on chemotherapy, really high doses of certain antioxidants may end up actually working against you because the chemotherapy is designed to do certain cellular damage to the cancer cells themselves, and those the antioxidants themselves can protect those cancer cells when taken in high amounts. So it's very important, once again, to work with your entire care team, talk to your oncologist about it before you start these antioxidants. But we also know that there are some antioxidants that are safe to be given at the same time as the chemotherapy agents. And there are studies that have used very specific chemo agents and very specific antioxidants together and found that they reduce risks of certain side effects developing and can even potentiate and make the chemotherapy be more effective. So it's a very individual discussion that we have with each patient, depending on what chemo agents they're using and that kind of thing. So back to antioxidants. When we think of antioxidants, I want you guys to think about the rainbow here when it comes to foods. The brighter and more variation you have in the colors of your foods, typically the more antioxidants you're naturally getting. So we think about things like beta carotenes, which are that beautiful golden orange color. We think about the zeaxanthins and the anthocyanins that are in berries and red cabbage that make that beautiful bluish color and red color. And we think about resveratrol with its like red color that we see in the grape skins as well. So what these are doing, once again, is helping support to reduce further cell damage from chemical exposures or trigger exposures that are going to be causing cell damage, even things like UV light for skin. And we know that they also, in reducing that inflammation that happens because of the cell damage, they can also help reduce tumor activity. So some superfoods with antioxidants in them kind of have mentioned some of the specific antioxidants, but now we're thinking about these beautifully colored foods. We're thinking things like turmeric, we're thinking things like our beautiful yams and squashes for those beta carotenes. We're thinking about salmon, which is going to have some antioxidants. Green tea has excellent research behind it. It's just such a vivid green color. Same thing with our kale and our spirulina. And we also know that garlic and ginger, even though they're not the most brightly colored, are also going to be strong antioxidants as well. So we wanted to talk about a few key antioxidants just to have on your radar, and we've put in dosing amounts that are common in the research studies and within our practice as well, just for reference for you guys here, so you're welcome to refer back to that. But our turmeric is one of our favorites. It's got great research, and there are even specific research studies for that specific herb when used with different chemo agents. There's just a ton of research on it. It happens that it does sensitize and make certain chemo drugs more effective. We also know that it helps reduce inflammation and can reduce tumor size in some instances. We usually are using turmeric extracts, and we're pretty specific about which ones and the dosing, because a lot of turmeric is given with pepper, and that can be really hard on the gut system. So usually we're working using a pre-converted turmeric formula with our patients, and we're discussing that quite a bit with them as we're seeing them. We also really love sulforaphane, which is found from broccoli seed extract. And this one specifically affects that programmed cell death signaling, and is a very, very strong, it's our strongest antioxidant that we know of. So it's just a really cool natural phytochemical substance that's found right there in our plants, in our broccoli seed, but we give it in an extract form that is a very specific amount typically, and there's really good research to show that as well. We also are thinking about things like resveratrol, which is found in wine and in grapes. And this also has been shown to play a role in that programmed cell death. And often we find that it needs to be combined with another antioxidant to do a really nice action. So the research shows that things like quercetin, which is the main antioxidant in onions, curcumin, which is from turmeric, or these polyphenols we see in many different foods, like even found in different berries, they are going to be helpful to really activate the resveratrol. We wanted to also mention green tea extract because there's so much great research on that as well. And this isn't the caffeine component of the green tea, but rather it's the portions of the green tea that really contain those antioxidant constituents, ingredients. So they're going to be also really helpful for reducing the tumor promoting inflammatory response, and has been really shown to help reduce the actual growth signaling for certain tumors. So I wanted to give one more plug here to sulforaphane because it has such phenomenal research for so many different types of cancer activity. The typical dose on that from the research studies is around 50 milligrams a day, depending on what type of tumor or cell lines we're dealing with. We can find natural sulforaphane in that cruciferous veggie family, and we just love those cruciferous veggies. They come up over and over again when we're looking at preventative diet strategies for reducing cancer risk. They contain a lot of fiber, but they have all these other nutrients in them that we know can help with immune and hormone modulation as well. But this very strong antioxidant of the sulforaphane we get once again by doing a large extraction on these broccoli seeds. So it's a very high quantity of broccoli seed that goes into just making one pill even, but it can be used almost as a pharmaceutical action when it's given in that dosing form. Turmeric, these are some of the most common ones that we use. We're usually having a conversation with our patients about what's going on for them as far as their risk for acid reflux. Some turmeric can be causing a little bit of acid reflux for patients, so we're always careful about that. And then we want to talk to them about whether they want liquid, a gel tab, or a capsule for that. And once again, these are always free of pepper because that can be an irritant. And especially if we have patients going through chemo, their gut lining is going to be really disturbed a lot of times from that. So we just want to do everything we can to really protect their gut lining and keep those cells from being irritated. CBDs we wanted to mention because there are really cool studies showing that they can be really helpful. And once again, it's that antioxidant activity within the CBDs. And typically in the studies, it's being used orally for patients. And we know that those antioxidants can once again really help induce that programmed cell death and help reduce any risk of cancer initiation, as well as help with the actual oncology process of reducing that tumor growth. We're going to talk about mushrooms next. Dr. Mary, you want to take it away?
Right. So we were discussing that we can bring mushrooms in our diet, and we can also bring mushrooms in supplement form. And these are really, really great forms of medicine to take because they act on our immune system in this really interesting way, where they do what we call modulate it. So rather than being very stimulating or very kind of antagonistic to the immune system or suppressing the immune system like a steroid, it helps it kind of maintain a balance. And they do this by acting with these really specific mechanisms where they'll help immune systems bind to cancer cells. And so helping kind of maintain a level of activity that we want. So we want our immune cells to be surveying our body on a daily basis and looking for abnormal cells or cells that have signs of cellular damage or cancer formation, and then be able to take them and dissolve them and process them. So turkey tail is one that there's some really interesting research on. There was some cell line studies where they showed that an extract of it helped the immune cells more effectively kill the cancer affected cells. And these are specifically for a type of cell that has a marker, a type of tumor cell that has a marker called HER2 that you may have heard of within breast cancer cells. And so this is really promising. So we use turkey tail, especially when someone is HER2 positive, and often when there is any kind of breast cancer that we're dealing with. There's also promising results in a phase 1 clinical trial in humans that were looking at that specific cancer cell line in breast cancer as well. We also have lion's mane. You may have heard of this mushroom used for brain health. And we specifically use it for nerve protection to reduce the numbness and tingling and pain that people can get after they're exposed to chemotherapy agents. That's a huge side effect of chemotherapy that we like to treat with many different things. And that's known as peripheral neuropathy. So that's one of our main go-tos for peripheral neuropathies. We also have reishi or Ganoderma lucidum. This is one that we can use long-term more for as a preventative strategy. It was shown to decrease breast cancer cell proliferation in a cell line study. And this is one, again, we want to use long-term, but if someone already has been diagnosed with breast cancer and we're looking to reduce recurrence, we'll often bring on a combination of mushrooms such as turkey tail and reishi specifically to help prevent further recurrence. So in terms of cellular protection, we've talked about a number of different mechanisms at this point. And I just want to, this is going to be kind of a reference slide for you, but I just want to explain that there's many different ways that we can support our cells and through many different mechanisms. And each of the supplements that we recommend are gonna sort of address oxidative damage and inflammation and all of those kind of cancer stimulating mechanisms in different ways. So flavonoids we discussed, those are some of our major antioxidants that can take free radicals and shuttle them into their molecular structure. We've got essential fatty acids that are going to reduce the inflammatory reactions long term, and that is good for long-term cancer prevention. We've got mitochondrial support, so that's really important, particularly during chemotherapy and during cancer treatment. There's a lot of fatigue associated with that, and we really want to support folks' energy level on a cellular basis. Methylation support, so it's through methylation that we build all of our cells and proteins, and this is really important again when we start to get really depleted through largely chemotherapy regimens. So we want to make sure that these cofactors are on board for all of these essential cellular processes. And then lastly, we've got the herbs and mushrooms that we'll be kind of peppering throughout the talk that can be very useful. So when it comes to the immune system and helping modulate the immune system, we really want to think about our microbiome. So our microbiome has a very intimate relationship with our immune system. We have a very extensive immune system in our intestines, and that communicates with our immune system throughout our body and can really play a big role in systemic inflammation. So we want to think about having probiotics on board, whether those are in food or supplement form. Some of the ones that we'll want to consider are lactobacillus and bifidobacterium in our probiotic supplements. And we'll discuss more on the microbiome in a second here. So we talk about the microbiome in almost every lecture because it really is a true determinant of health. So it can affect our immune response, it can affect our tissue pH, nutrient absorption, metabolism, it can affect our cell aging and cell division, and then also really have a major impact on our cognitive and hormone function. And again, we really want to think about supporting our gut microbiome through a couple of different ways. So one is going to be those probiotics, where we're bringing actual bacterial organisms. For these, you really want to make sure it's a good quality probiotic with with billions of cells in it. And you want to make sure that it's refrigerated in the distribution process. So we can help you think through those here at Prosper. We really like to use probiotics. And in our food sources, we can get it through a number of fermented foods like sauerkraut and kimchi, yogurt, kefir, miso, or kombucha. These are all really yummy examples that we can bring into our diet on a daily basis to kind of feed our gut bacteria and largely prevent any pathogens from taking hold in our intestines. The other thing we want to think about is prebiotics. So this is kind of like adding nutrients to our soil for our gastrointestinal system and feeding those good bacterial flora. So that is largely done through having a wide range of fibers in the diet. And there's specific fibers like inulin that can be really helpful. And so you want to think about where you're getting your fiber and what type of fiber you're getting on a daily basis. So some specifics with prebiotics, we can get these through food and herbs. For instance, Chickpeas, as you can see on the right, are a great source of fiber that bacteria really thrive on feeding on. And we can also get it through things like artichoke root. Fiber, things like inulin can be really helpful, but generally we just want a variety of fibers, including the kind of really fibrous, not insoluble fiber and soluble fibers like chia seeds. And then we want to think about other supplements like aguar gum. If you are struggling with dysbiosis and you have SIBO, aguar gum is a SIBO-friendly supplement that you can consider. All right, next I'm going to pass it off to Dr. Rosalie to talk about self-care strategies.
Thanks so much. So self-care is a big one when it comes to prevention of all sorts of disease, but also, including cancer. Self-care is not selfish. It's not self-indulgent. It's just this concept of taking time for yourself, for your mind, body, spiritual health. And it involves all sorts of different things that are very much specific to an individual, from different modes of exercise and movement to stress management, from meditation to social connection to maintaining healthy boundaries within relationships, to sleep. Not everyone needs the same exact amount, but some people definitely need more than others. So part of self-care involves moving the body, which is something that's hard to do these days unless you sort of pencil it in for yourself, or you have a physical job. So movement, what I like to tell my patients is that movement is your type of exercise where you can break out in a sweat ultimately, because sweating, like Dr. Mary mentioned, is helpful for detoxing the body, right? The skin is our largest organ, and sweating is helping move toxins through the body and excrete them ultimately through the sweat, especially the fat soluble toxins, which is where a lot of things will build up in the body in those fat stores, from pesticides to phthalates that were discussed earlier. Sleep, another big one when it comes to self-care and prioritizing your health. Sleep is where we do all of our heavy duty healing, not just physical healing, but also emotional healing. And during that time, we get a boost of melatonin, which is a natural antioxidant that we can also supplement at times for this reason, to help with insomnia. There's all sorts of other hormones and metabolic processes that happen during sleep that are helpful for inflammation, cancer prevention, and detoxing in general. So before bed, to optimize sleep, it's really important to avoid TV, screens, and light stimulation. Sometimes, 1 to 2 hours before your desired bedtime, since those diminish the amount of melatonin that the pineal gland gives out to that would otherwise be helping you sleep, promoting your sleep. If you wake up to urinate in the night, it's really helpful to decrease your water intake 3 hours before sleep as well, to sort of omit that trigger that would otherwise be waking you up. Same thing with the GI tract. If you're eating a large amount of food right before bed, it's very possible that your GI tract takes longer to digest through that, and you could have some acid reflux or just general indigestion, another reason why you would be waking up. Alcohol can also contribute to nighttime wake up. And that has to do with the fact that alcohol is a type of sugar. And when you have a sugar spike and then it's followed by a crash, that crash is what wakes you up in the night. Tobacco smoke is a type of stimulant. Again, we're avoiding that, as well as caffeine late in the day. B vitamins can also be stimulating. And as I mentioned, caffeinated foods and beverages. And what's helpful here is also to add a little bit of protein in your evening meal, or actually a substantial amount. And that's because the proteins are the ones that will help with basically the building blocks for the melatonin that you are creating late at night. So, you know, stimulants are going to be things to avoid if you're trying to improve your sleep quality. And they're found in all sorts of different foods, from chocolate to caffeinated drinks, like soda even. Sugar can be stimulating from that hyperglycemic perspective. Food additives and colorings, especially red colorings, red dye, can be very stimulating. Processed foods as well, quite inflammatory, as well as things like MSG. And to support sleep, there's all sorts of nutritional support we can consider. That L-tryptophan is a precursor for the sleep hormones, melatonin. 5-HTP, precursor to serotonin, which is also required for sleep. And then all of these other minerals can be, if you are depleted in these, they could contribute to a diminished quality of sleep. So melatonin is of interest here. There's all sorts of different kinds out on the market. The one that's on the left here, the melatonin SRT, is a extended release formula that I end up using with patients who have a hard time sleeping through the night, because it's sort of the melatonin supplement helps with that mid or like 3 a.m. wakening. The center melatonin there is sort of our physiological dose of melatonin. 3 milligrams and below is what your body typically pumps out. Sometimes we need a little boost there. So that's a physiological dose I would give for patients to help with initiation of sleep. And then all the way on the right is our high dose melatonin, which I use in very rare cases. And I use it not for the sleep support, but because it's a potent antioxidant, right? We had mentioned it earlier. And this is something that, the science goes back and forth on whether it's a really healthy thing to be taking this much or not. So it's something to definitely discuss with your physician if you are on high doses of melatonin.
We wanted to make sure that we specifically spoke about breast cancer today because we have so many patients who do have that type of cancer in particular, and it has this, specific addition of the hormonal sphere for those cell lines that can be really a huge factor for people. So really important for prevention and treatment and, working with these patients for further relapses of it. We want to make sure that we're really avoiding endocrine disruptors. So those are things and maybe chemicals or even lifestyle activities that are interfering with the production of hormones or interfering with the proper breakdown of those hormones. We wanted to also touch on phytoestrogens, whether they're good or bad. piece for an individual is a discussion that we usually like to have one-on-one with patients, but we wanted to make sure we touched in on that today. And then we also want you guys to understand that this conversion of the hormones, those estrogens through the body, the specific conversion makes a big difference in regards to the toxicity of that hormone on the cell lines. And then we also have specifically, we think back to medicinal mushrooms, which we touched on earlier, specifically for breast cancer, adjunctive care. Things like the reishi and the turkey tail have great research behind them. So let's talk a little bit more about these endocrine disruptors. This is a nice little graphic that kind of shows different chemical structures and exposures that can absolutely affect the hormonal signaling, and it can affect how these hormones are being modulated and therefore affect how our cell signaling is working. And that's a big deal for us. So if any of those are concerning to you in regards to exposures, please make note of that, because that's a very important thing in getting the hormonal sphere really properly protected. So as with our phytoestrogens, that's the next big topic here. And these are essentially plant chemicals that mimic estrogens. And we find them in several different plants, and we'll go over those in just a second. But what they can do is, because they fit like a key into a lock here of the estrogen receptors, they can essentially trick the body into thinking that there is estrogen being delivered. And this can be to our benefit sometimes during cancer care concerns, or it can be to our detriment. And there are studies on both sides of the fence here. So it's always really important for us to think about exactly what's going on for our patients. We know that because they have these estrogenic effects on the body, they can be protective for things like our bone density. They can be protective for our vaginal cells, and they can really reduce some of the discomforts of having low estrogens that we go through either postmenopausally or as part of our cancer or conventional cancer care side effects. So they can be really helpful, and there can be times that we want these to be involved. And then there are other times where we don't want any estrogenic effect for the person if there's a very high risk of recurrence because of hormonal issues. And once again, there's tons of studies on this, and they come down on both sides of the fence there. So once again, it's important to look at the specifics for the individual. Now, we do see that in chemopreventative cases, we get like a chemopreventative effect at low dose for these. And we also like to be thinking about these, in regards to where the woman is in her cycling history, if she's currently menopausal or postmenopausal or premenopausal. So different sources of these phytoestrogens for you to be aware of are, of course, we talk about soy quite a bit. Flax is a pretty heavy duty phytoestrogens, but there are others like fennel and even celery, parsley, apples, alfalfa, red clover. These can all have phytoestrogenic effects, as can beer. The way that we often are working with phytoestrogens in our practice, other than giving them dietarily, if we decide that they are appropriate, is going to be through a measured form, often through a supplement. And this is nice because it allows us to really choose the quantity that we're giving and really be able to track what's going on for people when they're taking it. And this is a specific product, which is essentially ground flax seeds that's been measured out to make sure that it has those lignans that have those phytoestrogens in them. Other really key pieces for breast cancer risk reduction comes in the form, once again, of this brassica or cabbage family, that broccoli, cauliflower, cabbage family. We have a few different compounds that are found in these foods that are just phenomenal, and we'll give them as extract supplements, specifically to do different actions for the body with hormonal regulation. So we have indoles like I3C, and we have DIM as being two of the best researched here. They help specifically convert these estrogens so that they're in a less toxic form, and then can be excreted out through our colon, through our stool. And we also have seen that this can affect our the people with the HER2 new mutation, and it can affect how these cancer cell lines are responding to certain treatments. Another really awesome phytochemical, which is found in the same family of veggies, is calcium D-glucarate. And we see this chemical specifically help conjugate and remove the estrogens, because it's all about removing excess amounts of these more dangerous estrogens to protect people from these abnormal exposures to these hormones. So this can be really helpful, specifically when we're thinking about the estrogen dependent tumors. And we wanted to also make sure that we touched on some of the therapies that we can support with during chemotherapy. So Dr. Mary, I think you're going to be taking this part.
All right. So when we're undergoing chemotherapy, if you ever need to undergo chemotherapy, you want to think about the fact that the chemotherapeutic agents are preventing new cell growth. That's one of the main mechanisms that a lot of them use. So they're, and that's often because tumors grow quickly. And so we're trying to prevent new cell growth in that way. But our bodies have many different forms of new cellular growth, and that can be in our digestive tract, in our skin, and in our immune cells. So those are three areas that we really want to think about supporting during the chemotherapy process. So some of the main things that we'll see in the digestive tract are going to be diarrhea and nausea and vomiting, because you're just not producing that same gastrointestinal lining that your body normally would. So in this case, we really want to use therapies that are gonna support the growth of those cells and give them of the cells that line the gastrointestinal tract, and give them as much sort of nutrition that we can, so that when they are growing new cells, they'll have the ability to. So we'll want to consider probiotics to reduce the probiotics are specifically going to reduce inflammation in the gastrointestinal tract. And that is important because as we have this compromised lining of our digestive system, we're going to have more inflammation that ensues, with more crosstalk between our food and our immune system. We also really want to use probutyrate. Butyric acid is one of the main foods that are the cells that line our colon use. And so that is kind of their bread and butter that we want to give them. And then we also want to think about glutamine. That's also been shown to be helpful for maintaining the gastrointestinal lining. So nausea and vomiting is a major side effect of chemotherapy that can really, prevent people from eating and cause some major weight loss and many different issues. So we want to bring on board any therapies we can, including ginger. You can do this in a tea form, or ginger chews can be really helpful because you're not getting as much kind of liquid in your digestive tract. And then we want to consider inhaling essential peppermint oil that has been shown to be helpful for reducing nausea. And then acupressure at P6 which is right in the center of the wrist. If you take your hand or your 3 fingers and then go right on the other side of that, in between the tendons, that's a major acupressure point for controlling nausea. So for peripheral neuropathy, this is another major side effect of chemotherapy that we are often addressing through acupuncture and supplements and herbs. We want to think about alpha lipoic acid. It's been shown to be supportive in the cases of peripheral neuropathy. Before I mentioned lion's mane can also be quite helpful. And then we want to consider cold packs, gloves, and socks. So this is kind of going in that vein of the contrast hydrotherapy that I was discussing before. That contraction of your blood vessels and kind of that cold contrast will stimulate your body to increase circulation in your extremities, and that can be really helpful for controlling the burning and numbness that can happen with the peripheral neuropathy. And then lastly, we want to look at cancer fatigue and low blood cell counts. So that can, again, happen with chemotherapy because we're not producing new cells or producing less new cells. And so in order to, when blood cell counts get down to a certain level, we really want to think about boosting them. And we can do that with a couple of different herbs, including astragalus that I'll discuss when we dive into the traditional Chinese medicine, and then with certain medicinal mushroom extracts as well. So here's just a reference list for you of not all botanical medicine is what we want to bring on board during chemotherapy treatment. And there's specific ones that we really want to avoid. Again, we're constantly working with oncologists to make sure that their therapy is effective while we're going through the naturopathic therapies. And so avoiding things like ephedra, ginkgo, ginseng, green tea, arrowroot, St. John's wort, valerian, and kava kava, that's all really important so that we're not impairing the effectiveness of chemotherapy. Okay, so next I'm going to dive into the traditional Chinese medicine perspective and treatment. So here at Prosper, I practice naturopathic medicine, and I also have a background in traditional Chinese medicine. So I practice acupuncture and use a lot of traditional Chinese herb formulations. And I love using this modality or this kind of medical tradition because it offers a different lens into treatment for a lot of conditions that Western medicine has a hard time getting at. So in traditional Chinese medicine, there's this concept of blood stagnation. So blood stagnation, so our blood is something that circulates in our vessels, and it's really important for nourishing our body. It's very similar to the Western concept of blood. And there's this concept that it can get stagnant and cause masses and pain formation. So in the traditional Chinese medicine philosophy, tumors are a sign of blood stagnation. And this is something that's rather metaphorical and not to be taken literally in the way we understand it in the Western sense. So in order to prevent tumor formation or cancer formation from a Chinese medicine perspective, we want to move qi, which is our major animating element in traditional Chinese medicine, and blood, which is the nutritive liquid that I was discussing before. We'll do this through nutrition, through herbs, acupuncture, and therapeutic movement. So traditional Chinese medicine is really great with addressing the side effects of chemo and radiation. So we often are using it adjunctively. And from a Chinese medicine perspective, a lot of these side effects have to do with what we call toxic heat accumulation, damage to our bodily fluids. We'll see a lot of dryness and heat production in the side effects of chemotherapy and radiation, damage to qi and blood, and then damage to our digestion, like I was discussing before. So in terms of Chinese herbal medicine, there's many different formulas that we would use for many different side effects of chemotherapy and many different symptoms of various kinds of cancer. One example of a commonly used and well-studied formula for cancer, for treating the side effects of chemotherapy is Dangui Bu Shui Tang. And this is used when red and white blood cell counts get really low. Again, those are some of those cells that are produced less and less during chemotherapy. So in order to promote their growth, we'll often use this combination of two major Chinese herbs, and that includes astragalus or huang qi and angelica or dangui. So astragalus is one of our main immune modulators, so it's going to help the immune system essentially work more effectively, kind of downregulate it. And this is often used for kidney support in Western and traditional Chinese medicine. So from a Chinese perspective, it can help raise the qi, so kind of really good for fatigue, support our digestion, and support wound healing, which can also happen during chemotherapy regimen. So next we have Angelica sinensis. So in traditional Chinese medicine, this one is really good for building blood and promoting blood flow. And it has been shown to promote activity of immune cells that target cancer cells. So remember I was saying there are specific immune cells that target tumor cells. And this is one of those herbs that can enhance their ability to do that. All right, so lastly here we've got acupuncture. I use this extensively as support for patients during cancer treatment. And we'll want to consider this for pain management, which can arise from many different types of cancers. We'll want to think about neuropathies after chemotherapy. That's a huge one. And, I have treated a number of patients for post-chemotherapy neuropathy, and they will, there's often a significant improvement in the burning and numbness that people will experience. And it is something that, patients will need to stick to for about 6 months. But if, often I would see when people weren't doing the acupuncture, it would make their symptoms significantly worse. Specifically for this, we are often using electroacupuncture. So that's something where we're using some minor electrical stimulation on the needles, and that is kind of activating the nerves. And so in a peripheral neuropathy, we often have nerve damage, and that numbness and tingling is because they're not kind of firing properly. So essentially, we're attempting to wake up the nerves with the electrical stimulation. Acupuncture is really great for stress and anxiety. Cancer treatment is an extremely stressful time, really emotional, and that is a piece that we really pay attention to from the holistic perspective. It's also can be really useful for nausea and vomiting during chemotherapy. And then it's also very helpful for the hot flashes, fatigue, and body pain that can come from estrogen blocking medication. So after breast cancer, many women are on estrogen blocking medications to prevent recurrence. And this is another specific condition in which acupuncture shines in treatment.
So another Eastern medical practice that comes from India is Ayurvedic medicine. And it's interesting to hear Dr. Mary's perspective with the traditional Chinese medicine, because it seemingly, these Eastern modalities usually go hand in hand, but it seems like with cancer, they're a bit different, which is interesting to me. So cancer is in Sanskrit grahani, which just means growth, and the root cause is trifold. Okay, so all three of the doshas are involved. So doshas, as you can see, are in the top right image there. Those are our three doshas, and imbalance is what is the goal of Ayurveda. So kapha being the earth element predominantly, that's the one that leads to growth and tumor growth. Pitta being the fire element predominantly, that's the one that leads to inflammation. And then vata being the air element predominantly is the one that moves the cancer cells around and leads to metastases. So from the Ayurvedic perspective, there's many things that can be done to prevent and to help treat cancers. Predominantly is the first part, which is known as chikitsa, which means your daily routine, which is preventative medicine ultimately, that is geared towards your specific doshas. So whether you have a lot of fire or you have a lot of earth element, your daily routine will be catered to pacifying those. There's a lot of good data on yoga being helpful for both prevention, but also adjunctive sort of symptom management when someone is undergoing chemotherapy. Also, Ayurvedically are these big concepts of building your Agni, which is your digestive fire. And this is, repeated in naturopathic medicine as well as traditional Chinese medicine. If your digestive fire is low, it leads to inflammation, it leads to stagnancy, it leads to fermentation of sorts. And that is essentially, not promotive to the body. In Ayurveda, you want to eat when only when you're hungry. So I know in this culture we tend to snack a lot, but Ayurveda really focuses on trying to space out those calories. In a way, it's a type of intermittent fasting that gets recommended. Another thing to do is to decrease your amma, which is toxin buildup, right? Basically by opening the detoxification pathways from your elimination channels of the GI tract to sweating through the skin. And lastly, one of the heavy hitters in botanical medicine Ayurvedically is an herb. It's a resin actually known as gugol, and it detoxifies all the 7 tissue layers in Ayurveda. So it works through essentially the whole body to detoxify all of those layers to ensure that, essentially the cancer gets worked through. So ultimately, this is a summary slide on how to prevent cancer. It's a multi-system approach, from foundations of health to hormone balancing to boosting antioxidants in the diet, as well as supplementing, and then adding in some alternative approaches. So that sort of culminates our doc talk here today.
We want to recommend and promote our talk in October, which is going to be on natural pain management. It's a really great one for people who experience chronic pain in particular. It should be really an insightful one. And we just want to thank you guys for joining us today and encourage you, if you're dealing with an oncology process or someone you love is, please contact us. Let's get working on it and make sure that we're doing everything we can to help. So I want to thank you guys. We really appreciate you, and we'll see you next month, hopefully.